parents are afraid of letting their children out.
One of the things they absolutely have to do is protect the people of our country. Not sure they need to provide everyone with health care benefits.
People pay their fair share and cut waste.
I think they ought to use it for our country, for education, for handling drugs and illiteracy.
I'm Vanessa from Minneapolis. I'm standing now in front of WCCO, our local Twin Cities CBS affiliate. They have a segment on the news where they ask a good question of people on the street. During this economic crisis, when our nation is involved in 2 wars, they have asked questions like, how do giraffes get to the Minnesota Zoo? Where do old TVs go? In the last 6 months, they asked 1 health care reform question, 1 question about Iran, and asked nothing about wars in Iraq and Afghanistan, nothing about our military. So WAMM, Women Against Military Madness, is talking with people on the street about the critical issues of our time. We're providing information the corporate media does not. Instead of just repeating the corporate military point of view, we're asking important questions.
Syed, I'm from Canada.
You're from Canada?
Correct.
Okay, where in Canada?
Oakville, Ontario. They did not do 9/11s at all. They were not involved, but somebody decided to go in and kill thousands and thousands and cause havoc in Iraq because of what?
You're from Canada. I'd like to ask what you think of the Canadian healthcare system.
Well, we appreciate that. We think the healthcare is fair to everyone, and sometimes there is waiting periods when you go for emergencies longer versus what you see in the U.S. But all in all, we don't have to worry about it, and everybody gets equal treatment. There's no difference between anybody, rich and poor. They could get the same treatment, which is fair.
Hi, my name is Ruxana Wagner, and I'm from Pakistan, but I'm obviously, by my last name, married to an American. And therefore I stay here. And my last visit to Pakistan was not very pleasant because I don't feel like it's our country anymore. I see all these Afghans filtering down. Islamabad is where my sister lives.
Well, do you think there's any connection between the Iraq War, the Afghan War, and our need for oil? Do you
Absolutely,
see that?
of course, of course.
That's
Why else
good
would we
for
do
you.
that?
Is that
Well, I don't use a lot of oil myself because I walk to work, so I'd prefer that we not be over there.
What's your first name and where are you from?
John from Minneapolis here.
Great. Do you think we can afford health care for our citizens and a $671 billion military budget?
I don't know if the two are mutually exclusive, but I definitely think we can afford health care.
You think we can?
Yeah, but I don't know if it has to be at the expense of any other programs.
Are you in favor of single payer, or what kind of program would you like to see?
I think single payer probably would be the way to go.
And where are you from?
Bloomington.
Bloomington? Great.
Well, that's where I live.
Okay. Any coverage, but the U.S. military budget is more than the combined military budgets of the next 20 countries. Mm-hmm. More than China, Russia, the UK, France, etc. put together. What do you think of that?
I think it's terrible. I think we're spending way too much money on the military budget. That's if we use that money for more constructive purposes like health insurance and employment, we could probably resolve or at least make some progress on these issues.
What do you think of our present healthcare system? What do you think of single payer?
Well, it's much too expensive.
Our present system?
Yeah, and there are a lot of people without health coverage, of course. But I have health coverage through my employer, so I'm pretty happy with it. But it's pretty devastating to people who don't have it.
Yeah.
My name is John. I'm from Minneapolis. No, I think the military budget could be reduced by 50 to 75% immediately. I think all of the troops outside the United States should be brought home immediately. And I think that most of the spending on weapons should be eliminated. I imagine that, I don't know the statistics, but I imagine that the cost of sophisticated weapons is comparable to the cost of the entire healthcare spending of the country, and that's where the money could come from to improve healthcare and education.
My name is John from Woodbury.
How do you feel about increasing the military in Afghanistan?
No, I think they should just bring everybody home. It's enough of that. Enough's enough.
It doesn't seem to be winning.
No, it just seems a big waste to me.
Yeah.
There's a lot of problems here in this country that need to get solved and need to bring everybody back home and spend that money here.
Yes, yeah. I think serving their country would be taking care of their children here.
Yeah, exactly.
Doesn't that sound like a good idea?
Right.
Yeah. And then we're asking if there's $1 trillion military budget, and how could that better be used? Or do you have ideas of how we could use that better than more?
You deal with the homeless situation, unemployment, definitely. Fix the deficit. That money going to war could be used in the deficit. Get people back to work and get the economy going.
What is your first name and where are you from?
Karen from Minneapolis. Well, I think it needs to be fixed somehow. I mean, health care is really expensive. Like, for instance, my insurance doesn't cover anything that I need, like vitamins, fitness center, chiropractor. It only covers if I went to the hospital or something. Well, I'm trying not to be there.
Your name?
James from Robbinsdale.
Do you think single payer is getting a fair shake in the media, or do you think it's being unfairly criticized?
It's not correct. It's not giving a fair shake. Money runs the system, profit runs the system, so we need to take things like that out of the profit stream and put it in a non-profit stream.